Hello, I'm Simone and I'm going to be performing your head to toe assessment today. I'm going to gather all my supplies. I have my blood pressure cuff, my thermometer, tuning fork, pen light, and reflex hammer, pulse ox, and the Snellen chart. Okay, I will provide privacy and I'm going to wash my hands. Okay. Can you please tell me your name and date of birth?
Margot Narciso, February 16th, 1962.
Thank you. And I'm going to ask you a few questions. Who is the president?
President Joe Biden.
What year is it?
It is 2021.
And where are we right now?
In the doctor's office, and I'm in New Jersey.
Okay. And can you please repeat back 3 words that I will tell you now, and then keep them in the back of your mind so that way at the end of the assessment I will ask you to repeat them again as well. Water, soccer, and reindeer.
Water, soccer, and reindeer.
Thank you. And how are you feeling today?
I feel good, thank you.
Okay, so patient is alert and oriented ×4. Patient is relaxed and calm and is in a good mood. Speech is clear, no delayed responses, and thought process and cognitive abilities are appropriate for patient's age and within normal limits. Okay, now I will do my vital signs. Are you having any pain right now?
No, I'm not.
Okay, so I'm going to get your blood pressure. Okay. Good. And we will do your pulse ox. Okay, and the temperature. Okay, good. Temperature 98.2. Pulse ox 98%. Blood pressure 110/60. And I'm going to get your heart rate and your respiration rates for 1 minute. Okay, heart rate is 70 and respirations are 18. Vital signs are within normal limits for a patient. Now I'll have to get your height and weight. Can you please stand on the scale? Okay, good. 110 pounds, and please stand ahead so I can get your height. Okay, good. 5'2". Okay, right. Now I'm going to inspect your head and face. So head is symmetrical and face is symmetrical. Head is appropriate size for the body. And I'm going to inspect and palpate your head, looking for any pain or tenderness. Do you have any pain or tenderness?
No, I don't.
Okay, so no masses or skin breakdown or infestations, no pain or tenderness. Okay, and now I'm going to palpate the temporal artery on both sides. Good, so temporal artery is +2, equal bilaterally, and I'm going to assess the trigeminal nerve. Can you please clench down on your teeth? And I'm going to feel the temporal muscle. Good, thank you. Okay, trigeminal nerve is intact. And I'm going to assess sensation on the face with a dull and sharp edge. Let me know if you feel dull or sharp. Okay, here.
Dull, sharp, dull, dull, sharp, sharp.
Okay, thank you. Trigeminal nerve is intact. And now I'm going to assess the facial nerve. Can you please raise your eyebrows? Thank you. And smile. Thank you. Smile is symmetrical and clench your teeth. Good. And frown. Thank you. And puff out your cheeks. Okay, great. Facial nerve is intact. And now I'm going to inspect your eyes. So the eyes are symmetrical, sclera is white and clear, the conjunctiva is pink, and no drainage. And I'm going to assess the optic nerve using the Snellen chart. Okay. I would be 20 feet away and ask the patient to cover one eye and read the bottom line for me.
STBACTL.
And then cover the other eye and read
STBACTL.
Great, thank you. And I'm going to assess confrontation. Can you please cover one eye and look at my nose and tell me how many fingers I am going to be holding up?
2, 1, 2, 1.
Okay, and cover the other eye. Look at my nose and tell me how many fingers I am holding up.
1, 2, 2, 1.
Okay, the optic nerve is intact. Now I'm going to assess the ocular, motor, trochlear, and abducens nerves. Can you cover your eye again? And no extraocular movements or strabismus, and then color the other eye. Okay, no extraocular movements or strabismus. And I'm going to use my pen light to assess eye movement and pupils. Okay, and I will have the lights dim and assess the pupils. Okay. Great. Okay, so pupils are equal 2 centimeters. They're round. They're reactive to light. And then you follow my pen light in towards your face with your eyes. Okay, and they accommodate. The ocular, motor, trochlear, and abducens nerves are intact. Okay, and now I'm going to assess your ears. And ears are warm and dry and intact. And there's no drainage or skin breakdown. And skin is overall warm and dry and intact. No skin breakdown and appropriate for ethnicity. I'm going to assess the vestibular, cochlear, and acoustic nerves using my tuning fork and the whisper test. So first we will do the whisper test, and I'm going to whisper in each ear, and please repeat what I whisper.
Happy New Year.
Thank you. And
Cold, snowy season.
okay, patient was able to hear the whispered phrases, and I'm going to assess the Weber's test. I will activate my tuning fork and put it on top of your head, and let me know if you can hear the vibrations equally in your ears, both your ears.
Yes, I hear it equally in both ears.
Okay, and I will reactivate the tuning fork and perform the Rhines test, and I will put it on your mastoid bone, and let me know when you do not hear the vibration anymore, and then I will put it next to your ear and let me know when you do not hear the vibration anymore.
No longer hear it. No longer hear it.
Okay, so air conduction is greater than bone conduction for the Rhines test, and for the Weber's test, tone was heard equally in both ears. The vestibular, cochlear, and acoustic nerves are intact. Okay, and now I will assess your nose. My pen light, so the nose is clean, dry, and intact, no skin breakdown or lesions. And can I please look in your nose? Good, airflow is patent and no drainage or bleeding. And I'm going to assess the olfactory nerve. I'm going to ask you to close your eyes and smell something and let me know what you smell.
Cinnamon.
Great. Okay, so the olfactory nerve is intact. Okay, now I'm going to assess your mouth. So the lips are symmetrical and pink and intact and dry, and no lesions or ulcerations or skin breakdown. And I'll use my pen light. And can you please open your mouth? Good, so the buccal mucosa is moist and pink, and the teeth are present and white. And can you please stick out your tongue? And tongue is pink and moist. And I'm going to assess the glossopharyngeal and vagus nerves. And can you please stick out your tongue and say ah?
Oh.
Okay, good. So the uvula moves up, and I would also assess the gag reflex. Swallowing is intact, so the glossopharyngeal and vagus nerve are within normal limits. And I'm going to assess the hypoglossal nerve. Can you please stick out your tongue again? Okay, tongue is symmetrical and The uvula is symmetrical and midline. And now please, I'm going to assess tongue strength. So push your tongue against your cheek on the right side and I will assess the strength. Good, and then the other side. Great, okay, so the hypoglossal nerve is intact. Okay, so I'm going to inspect your neck, and skin is warm and dry and appropriate for ethnicity. No lesions or skin breakdown. Trachea is midline. I'm going to palpate the trachea and thyroid. Any pain or tenderness?
No pain or tenderness.
Okay, so trachea and thyroid is within normal limits. And I'm going to palpate the lymph nodes. Let me know if you have any tenderness or pain. Okay, so the preauricle lymph node and the posterior auricle lymph node, the occipital lymph nodes, the tonsillar, submandibular, submental, superficial cervical, posterior cervical, deep cervical, and supraclavicular. Any pain or tenderness?
No pain or tenderness.
Okay, so the lymph nodes, there's no masses or pain or tenderness, are within normal limits. And I'm going to palpate the carotid artery one side at a time. Okay, carotid artery is +2. And I'm going to listen, assess for any bruit. Okay, there's no bruit, the carotid artery is within normal limits. And now I do range of motion for your neck. Can you please look to the right and look to the left? Great, and then look up and down. Great, okay, range of motion for the neck is within normal limits. Okay, now I will assess the thorax, and skin is clean and dry and intact and no obvious skin breakdown, and breathing is regular and unlabored and even. Okay, and I'm going to auscultate the lung sounds anteriorly and posteriorly. Take a deep breath in through your nose and out through your mouth, and if you feel dizzy or lightheaded, let me know, we could stop. Okay. Okay, anterior lung sounds are clear bilaterally. Now I'm going to listen to the posterior. Okay, posterior lung sounds are clear bilaterally, and I'm going to listen to the heart valve sounds. I will listen to the aortic valve on the right sternal border, second intercostal space, and the pulmonic valve, left sternal border, second intercostal space, and the tricuspid valve, left sternal border, fourth intercostal space, and the mitral valve, the apex, the point of maximum impulse, left sternal border, midclavicular line, fifth intercostal space, for 1 minute. Okay, so heart rate is 70, and the heart sounds are lub-dub, S1 and S2 were heard. Heart sounds are within normal limits. Okay, now I am going to listen to and inspect the abdomen. Okay, so the abdomen is no visual pulsations, no visual masses. Skin is clean, dry, and intact, and appropriate for ethnicity, and warm and dry. And umbilicus is midline, and the hair distribution is within normal limits. So I will first auscultate at the right lower quadrant, listening to vowel sounds. Okay, so the right lower quadrant and the right upper quadrant. and the left upper quadrant, the left lower quadrant. Okay, so vowel sounds are active and present in each quadrant within normal limits. And now I will perform palpation. First, light palpation. Let me know if you have any pain or tenderness in the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Any pain or tenderness?
No pain or tenderness.
Okay, and then now I will do deeper palpation and to assess muscle, abdominal muscle and organs, and let me know if you have any pain or tenderness. Right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Okay, any pain or tenderness?
No pain or tenderness.
Okay, abdominal muscles and organs are within normal limits and no pain or tenderness or masses. Okay, now I'm going to assess the peripheral vascular system. And can you please put your arms out in front of you to assess symmetry? And arms are symmetrical, there's no edema, skin is clean and dry and warm and intact and appropriate for ethnicity. Hair distribution is within normal limits. And I'm going to assess for skin tuber, okay, and no tenting. I'm going to feel the radial pulses +2 equal bilaterally and the brachial pulses +2 equal bilaterally, and assess capillary refill less than 2 seconds. Great. Relax your arms, and now I'm going to take a look at your legs. I'll just take off your shoes and okay, and take a look here at your legs. So skin is appropriate for ethnicity and warm and dry and intact. No ulcerations or skin breakdown or lesions. No edema. And the pedal pulses are +2 equal bilaterally, and capillary refill is less than 2 seconds. And hair distribution is within normal limits. And legs are symmetrical. Okay. And you can relax your legs. Now we will do range of motion. Can you please put your arms out to the side and then up next to your ears? Great. And then please put your legs out. Okay. And move your feet in. Good. For ankles, yep. And then out. Okay. So range of motion is within normal limits for the upper and lower extremities. Now I'm going to assess the spinal accessory nerve. And can you shrug your shoulders? And I'm going to provide resistance and don't let me push them down. Good. And then I'm going to have you look to the right, and then I'm going to provide some resistance, and please try to look towards the left. Okay, great. And then we will do the opposite side. Okay, so the spinal accessory nerve is intact. And we will do muscle strength. So can you please put your arms out in front of you so they're symmetrical and no drift. And I'm going to provide resistance, so don't let me push your arms down. Okay, great. And then squeeze my hands. Okay. And then we'll have your legs out in front of you and no drift. Legs are symmetrical. And don't let me push them down. Great. And then pull your toes towards your head. I'm going to provide resistance. Good. And push down on my hands. Okay. Relax. So strength is within normal limits, 5 out of 5 for the upper and lower extremities. Okay. Now we will assess gait. Can you please stand up here? Here's your shoes. Okay. And we'll have you walk towards the camera and walk back. Okay, good. You can stand up right here. Okay, so gait is smooth and coordinated and even. Now we will do the Romberg's test. You just move up a little bit. Okay, good. And we'll have you stand with your feet together and arms at your side for 20 seconds and no swaying. And now please close your eyes, put your arms out in front of you, and there's no swaying. You would do it for 30 seconds. And okay, great. You can sit back up here. So balance is coordinated and within normal limits. Now I will assess rapid alternating movements. Can you please put your hands on your thighs and open your hands to your palms in a fast motion? Okay, great. And then please touch each finger to your thumb. Okay, great. And then we will have your legs come out in front of you and put your right heel on your left knee and slide it all the way down and then back up. Okay, great. And then the other side, down and then back up. Okay. All right, so rapid alternating movements are within normal limits for the patient. Okay, now we will assess sensory function. And I am going to first put something in your hand and you close your eyes and then let me know what it is. Okay, so close your eyes now.
Scissor.
Thank you. Okay, correct. You can, okay. Now I'm going to have you close your eyes again and open up your palm. And I'm going to draw a number in your hand and let me know what number it is. 3. Great. Okay. And now I have a paper clip with 1 or 2 points on it, and I will poke your palm and let me know if you feel 2 pokes at the same time or just 1. Okay.
2 pokes.
Great. Okay, so sensory function is within normal limits and intact. Patient was able to identify 2 points. Okay, now we will assess the deep tendon reflexes using the reflex hammer. First, we will do the brachioradialis reflex. Okay, good. And the bicep reflex, let's see here. Okay. Relax your arm. Okay. A little bit up. Good. All right. And now the tricep reflex over here. Okay. Relax your arm. Okay. And the patellar reflex. Okay. Keep your leg limp and relaxed. Okay. And now the Achilles reflex. Keep your foot relaxed. Okay. Okay, so deep tendon reflexes are +2 and within normal limits for the patient. Okay, and now we will have you repeat the 3 words I told you earlier in the assessment.
Soccer, water, reindeer.
Okay. Great, so neuro assessment is within normal limits for the patient, and that includes our assessment. Thank you so much.
Thank you.